today's webinar is part of a series of webinars going on in marking the Patient Safety Week. So September 17th is usually the World Patient Safety Day, and we usually have several activities towards that day to just raise awareness amongst healthcare professionals and the public on patient safety. And the theme for this year's Patient Safety Day is Health Worker Safety, a Priority for Patient Safety. And on top of that, the WHO slogan for this year's Patient Safety Day is Safe Health Worker, Safe Patient. So it's meant to advocate for the health of the safety of health workers who play a critical role in patient care. And it's hosted by CAPI. CAPI is the Association of Pharmaceutical Industries. It's comprised of approximately 29 companies, mostly manufacturers and their local representatives, where they don't have legal representation in Kenya. So the association represents the manufacturers that through research invent and develop medicines and technologies, example of biopharmaceuticals, vaccine, healthcare, medical devices, diagnostics that significantly improve people's lives. So CAPI is the industry voice in Kenya, and it's still growing in promoting efficiency in the pharmaceutical industry for improved access to high quality, safe and effective medicines, health products and technologies for diagnosis, prevention and treatment of patients. So that's CAPI in a nutshell. And the work revolves around policy and regulatory advocacy on matters that influence access to medicines, health products and technologies, and to improve business processes while translating research to clinical practice through policy advocacy. So it's done through subcommittees. So CAPI has subcommittees that handle research and regulation, pharmacovigilance, trade and policy, compliance, medical devices and technologies, amongst others. So I'm honored to be the moderator for today's session. Myself, I'm a pharmacist and I work for Roche. I handle pharmacovigilance. The title in Roche is the Local Safety Responsible and Medical Project Excellence. And it's now my pleasure to introduce the panel for today's session. And on the panel, we have Dr. Elizabeth Gitau. Dr. Elizabeth Gitau is a medical doctor and an MBA healthcare management graduate with over 6 years experience in clinical practice in both public and private sector. She has experience working in banking, healthcare management, clinical teaching and research. She is currently the CEO, Kenya Medical Association, the umbrella association for medical doctors in Kenya that champions for the welfare of doctors and quality health in Kenya, actively partnering with government and non-government actors in health policy formulation and implementation. And our second panelist for today's session is Dr. Daniella Munene. Dr. Daniella Munene is a registered pharmacist. She's currently serving as the CEO, Pharmaceutical Society of Kenya, and the Director, Kenya Healthcare Federation. She has extensive experience in quality management systems, organizational regulatory compliance, and health sector advocacy. She has a passion for health education, well-being, and people empowerment, which she has leveraged on to mobilize the pharmacy profession in Kenya to successfully advocate for change in health policies for enhanced reach of primary healthcare. In this regard, Daniella have contributed to the development of various health policy documents, among them the WHO guideline on self-care for reproductive health. And we are honored to have our third panelist, who I will introduce. So our third panelist for today is Ms. Kibira. She's a registered nurse and she also holds a Master's of Science in Nursing in She is currently the programs officer for the National Nurses Association of Kenya. She's a nurse specialist in palliative care, research and education with a master's in science for palliative nursing from Tohoku University. She's a MEXT fellow, that's a Japanese scholarship awardee, 2016 to 2018. Currently, Jemimah is an Afya Bora Global Health Leadership Fellow, and her fellowship attachment at the International Training and Education Center for Health project was focused on quality improvement for infection, prevention, and control practices in Thika Level 5 and Kitale Referral Hospitals. Our fourth panelist for today is Dr. Clarice Ambale. Dr. Clarice Ambale is a pharmacoepidemiologist practicing at Machakos Level 5 Hospital. She has over 10 years of experience in hospital practice and has a passion for ensuring safe and efficacious use of pharmaceutical commodities. She's a national committee member of the Hospital Pharmacists Association of Kenya. She is also a member of the Pharmaceutical Society of Kenya, International Society of Pharmacovigilance, ISOP, and International Society of Pharmacoepidemiology. And then our fifth panelist for today is Dr. Jaimini Gohil. Dr. Jaimini Gohil is the chief pharmacist at the Aga Khan University Hospital, Nairobi. She has 12 years of experience in hospital pharmacy practice. She has a Master of Science in Pharmacy and International Practice. So before I invite our panelists to start discussing the different initiatives that they have in their institutions and hospitals and organizations to enhance healthcare safety, let me introduce the day. So why we are here today. So just a brief explanation on what the World Patient Safety Day is about. So this is a day where the world recognizes patient safety as a global health priority. So this was founded in May 2019 by all the 194 WHO members. And the theme of the year is in line with what the world is experiencing at the moment. The COVID-19 pandemic has unveiled the huge challenges and risks the health workers are facing globally, including healthcare-associated infections, violence, stigma, emotional disturbances, illnesses, and even death, and so many other challenges that they face in their everyday work as they take care of patients. So this year, we want to focus on the healthcare workers, on their safety, because this is a priority for patient safety. And at that point, I will invite our panelists to discuss with us what they do, how they're advocating for healthcare safety in their different organizations and in their different capacities. So the first panelist to talk to us today is Dr. Daniella Munene. So Dr. Daniella, kindly take it over from there and tell us what you're doing in your capacity.
Hello, thank you very much for that very generous introduction. Like I've been introduced, I'm Daniella Munene from the Pharmaceutical Society of Kenya. That's the professional society of registered pharmacists in Kenya. So I have a slide that will help me speak to what I want to share. If you can move to the next slide. Please move to the next slide. Please confirm that you can hear me.
Yes, we can hear you, Dr. Munene.
All right, no, the second slide of the deck. So I just want to do a very high level talk on how professional associations can promote health worker safety. And you know, I've thought about this in three main areas. And one of those is obviously making of guidelines and guidance documents for the health professionals in their society. And so a professional association can make checklists, job aids, and guidelines based on existing global guidelines, based on local level guidelines and data. A professional association is very well placed to synthesize and analyze existing data to make specific guidances for the specific profession. For instance, say for pharmacists, we have COVID-19 guidelines from WHO. We have COVID-19 guidelines from Ministry of Health. So what are pharmacists all about? They're about medication therapy management. And so where in those national and international guidelines, we're talking about drug therapy. So then what PSK can do and has done is do a deep dive into those drugs and provide a guidance that is much more detailed in terms of things to look out for, contraindications, drug-drug interactions, different patient populations, how they'll respond differently to those medicines. Even where to access these medicines. Are they available in Kenya? Do you need to import on a special permit from the pharmacy board? So then that guideline becomes way more usable by that health profession. And so from the guidelines, you can also make job aids to help your professionals do their job easier, and checklists as well. For example, IPC checklists. The second broad category that I felt professional associations can really help their health professionals to be safe is advocacy. And this is something that is a mandate of every professional society. And so health worker safety is no less an advocacy subject than any other that we've been advocating for. And we can advocate in terms of health worker safety for quality PPE, for more health workers to be deployed, for better health insurance, for safer working environment. And it's an ongoing process, as we all know. And our advocacy usually takes a long time. It can be quite frustrating. So, but with that outlook in mind, then you just keep going at it and approaching policy makers to make them see your point. And one of the things about advocacy is you might not even win in good time in the crisis at hand. But once policies are in place, they will always help you the next time. So the next time we have a pandemic, then our health professionals will be safer because of the advocacy we've done now. So I would urge my fellow colleagues on this panel, let us not tire of advocacy. The other broad category of things that we can do to promote health worker safety is dissemination of knowledge through effective communication. And this, we use various media available because we want to bombard your health professionals from all sides so that you ensure that they get the message. And so, we can use our databases, our usual method of communication through email, newsletters, journals, social media. And what's important about this is we must get the feedback. So as we are doing the messaging to, the whole list on our database, are we really taking time to do surveys to get the feedback from the members? When members tell you what is happening on the ground, as opposed to possibly what the government has said is happening, then it gives you, and it even informs your advocacy process, and it gives you a different angle in terms of communication. So we must engage in constant communication with our members, and we must also ask them to give us feedback, and then it's a continuous loop. With that feedback, we communicate again with them a message that's more relevant to them. And so during this dissemination of knowledge, we also need to focus on interactive platforms rather than just one-way platforms. So things like webinars come in here, where it's, you can have a constant interactive platform where people are chatting, asking questions, and sharing of knowledge. So really, in summary, I feel those are three ways that we can really leverage on to improve health worker safety. Next slide, please. So on the next slide, you'll see just a few examples of possibly what PSK has actually engaged in those broad categories of action. So as you can see there are some guidelines. On the left, you'll see a guidance called Pharmaceutical Care and Therapeutic Management of COVID-19 Patients in Kenya, an official clinical practice guidance document from PSK. So this is a document that's derived from the National COVID Management Guidelines and IPC guidelines, where we do a deep dive on drug therapy for our members to be in the workplace.
I'm going to request that everyone unmute their mic when the presenter is making the presentation, please. Daniella, you can unmute your mic, please. Hi, Dr. Daniella.
Okay, I've unmuted. Thank you for that, David. So, so as you can see, these are some of the ways we can disseminate information to members. So on the left, there's a guidance document from PSK on COVID-19 therapy, where we've done a deep dive on drug management of COVID-19. And so our professionals then feel better prepared to manage their patients and better prepared to protect themselves. This is in the middle, there's a peer-reviewed journal from PSK. Again, we're encouraging our members to engage in research in their workplaces, to provide data, to synthesize it, to analyze it, and to come up with manuscripts that are publishable. And this goes to enrich the body of knowledge that we can disseminate through this journal. On the right, that's guidance from the International Pharmaceutical Federation. And it's a guideline for pharmacists and the pharmacy workforce. And in there's a lot of good reference documents for health worker safety in pharmacy practice. In the bottom strip, you'll find images of some live webinars. We post these webinars on our YouTube channel so that the people who miss the live webinars can actually access the full presentation. And this is just a peer-to-peer discussion on what pharmacists are doing to keep themselves safe and to treat their patients on COVID-19. So really, this is a snapshot of some of the things that PSK is doing to just keep our members safe and well informed. Thank you very much, Kapi. Thank you, David. That's it from me. I'll be happy to answer questions during the panel discussion.
Thank you so much, Dr. Daniella, for that informative presentation and for the great work that you're doing as PSK. And to the participants, kindly type in your questions through the chat as the panelists present. Then we'll be able to read them out at the end during the Q&A session. Thank you so much, Dr. Daniella. And next, we are going to have Dr. Elizabeth Gitau presenting. So welcome, Dr. Gitau to present. Wow.
It so happens that Dr. Gitau has some connection issues. Maybe we could move to the next panelist.
Okay. Thank you, David, for that. So on that note, then I'll welcome Ms. Jemimah Kibira to present. The floor is yours.
Thank you. Thank you very much. I hope all of you can hear me. And first of all, I want to really apologize. I did not make a PowerPoint presentation because I was told this quite late yesterday. But in terms of what we have done so far as a professional association, that is the National Nurses Association, I'll give a brief based on what we've done for COVID-19 and also what we have done continuously to support the patient safety program. Generally, my name is Jemimah Nyawera. I'm a nursing officer and the programs officer at the National Nurses Association of Kenya. So I'll just straight dive into what we have done so far. I'll mention briefly about the support for healthcare professionals during this COVID-19 with the partnership we have with the Kenya Medical Association, Kenya Clinical Officers Association, and the Equity Group Foundation and Kenya COVID-19 Fund, whereby a committee was formed made up of healthcare professionals who were advising the technical working group for Kenya COVID-19 Fund on quality control for PPEs and also supplying PPEs to healthcare professionals. And probably everyone on the call is aware of what has been going on. And so far, we have managed to supply PPEs to at least all the facilities, all the isolation facilities, the MOH isolation facilities for COVID-19. And if Dr. Gitau will manage to join the call, I'm sure she'll be able to add more information on that. Besides that, and we all know that patient safety is also beyond the physical kind of safety, the psychological safety is also important, and being able to ensure that healthcare professionals are able to provide care in a situation where their own psychosocial needs are catered for. It's also very important. So what we've also gone ahead to do, and I would say that is one of a kind here in our settings and probably in East Africa, I'm not very sure about the other regions, is that we were able to set up a wellness center for healthcare professionals through a call center support system. This call center is hosted at the National Nurses Association of Kenya, and we have mental health service providers who man the call center. We run on a 5-day, Monday to Friday, 9 a.m. to 10 p.m. service. And so far, since we started in July, we've been able to receive more than 50 calls from healthcare professionals. And most of the concerns that we've been able to address are around psychosocial first aid management for healthcare workers, how to deal with anxiety, the issues of stigma, especially around COVID-19, because stigma is not only to the patients, we also have healthcare workers actually stigmatizing one another, even without knowing, because everyone is out to protect themselves. So in a sense, that way we've been able to also cater for the healthcare professionals themselves so that they can be able to also be functional and provide services as and when they're required. We've also been doing mental health webinars every Tuesday where we discuss issues to do with mental health support. We've discussed issues like what is the burden, the duty to care versus the fear of contracting COVID-19, especially while you're providing healthcare services. And we've received a lot of positive responses from the healthcare professionals because these webinars have been sort of a session to debrief, to share experiences. One of the webinars, we actually got healthcare professionals who had tested positive for COVID-19, and them coming forward and sharing their experiences actually played a very critical role in making the others know that this is something that we can all overcome. And being able to share those experiences in a way also improves the quality of care that they provide to their patients. Over and besides that, and as Daniella had said, one of the other roles that professional associations play is developing SOPs and job aids, especially for clinical practice. And as an association, we have been one of the associations that have been developing the IPC training curricula for healthcare professionals. And this curricula touches on basically all the key fundamental areas for infection prevention and control. That is HAIs, healthcare-associated infections. We touch on occupational safety and health. We touch on environmental hygiene and sanitation, behavior change communication for infection prevention and control. And the other thing that the associations have been very keen on is supporting HAI surveillance, because we know that HAI surveillance is quite expensive within our settings, but with support that especially the Ministry of Health gets for conducting HAI surveillance, we have also supported healthcare professionals and building their capacity to do HAI surveillance within their facilities. And as an association, we have been actively involved in HAI surveillance, especially for surgical site infections in Thika and Kitale hospitals, a CDC-funded program that has really been supporting especially the focal IPC persons to conduct surgical site infection surveillance within their facility, and how to really use that data to inform practice and decision making. Thank you very much. I think I'll stop there for now and allow the other panelists an opportunity, and then probably come back for the next round. Thank you very much.
Thank you so much, Jemimah. Thank you for that presentation. It's really encouraging to learn that there's already so much that is being done around the healthcare safety advocacy. And it's interesting to even listen to the next panelist and know what they are doing in their area. So at this moment, I will welcome Dr. Clarice Ambale to share with us their initiatives and what they are doing. Welcome, Dr. Clarice. Hello, Dr. Clarice.
Hello, good afternoon.
Good afternoon.
Yes, I'm trying to screen share. I have a presentation. I'm trying to screen share.
Well, I can share it on your behalf from this end, if that's fine.
Yes, please.
Perfect, on it. Can you see my screen now?
Yes, I can.
Perfect. So you can carry on from now.
I can't see the first slide. Okay. All right. So good afternoon once more. My name is Clarice. I'm a pharmacoepidemiologist. I work at Machakos Level 5, and I'm a committee member for the Hospital Association of Pharmacists of Kenya. So I'm representing my organization today. HOPAK is an association of pharmacists working in hospitals, and it was founded in 2003 and later registered in 2015. Its membership has grown over the years, and currently the number of paid up members is close to 300. We have different membership categories ranging from ordinary members all the way to corporate members, which is limited to hospitals only. Next slide, please. So our vision is to be the reference of excellence in pharmaceutical care, research, and professional development in hospitals. Next slide. And we have various missions. I'll mention a few. To increase the standing, influence, and profile of hospital pharmacy through the national office and its branches. And I'll go straight to the last one on that slide, to promote and provide continuing professional development and interaction between members through conferences, seminars, and special interest groups. This ensures that members are continually capacity built to grow in their profession and even other social aspects. Next slide. Next. Okay, so the main objectives of HOPAK are to promote the best standards in patient-centered care, to ensure that the patient is our focus as professionals, and to foster practice-based research, also to create an enabling environment for members to develop professionally, which I've already alluded to in the mission, and also to advocate on pertinent issues related to hospital pharmacy practice. As you know, pharmacies, we can practice in the hospital, in the industry, or even in the community. So HOPAK advocates for pertinent issues that are affecting hospital pharmacies only. Next slide. So what interventions are we doing to advance the safety of healthcare workers? Mostly we do educational interventions through webinars on proper use of personal protective equipment, especially masks and others. We also encourage the rational use of personal protective equipment, and we also report on the quality. As we all know that pharmacies are the custodians of commodities, they're the ones who order and receive. So when receiving these commodities, we encourage our members to check on the quality to ensure that the quality is good and will adequately protect the healthcare worker when using it. And in case the quality is not up to standard, they need to report the same to the Pharmacy and Poisons Board so that action can be taken. We also train our members on proper disinfection procedures for high-touch surfaces, as we know that there are counters in the pharmacy and patients can sometimes come and touch them and crowd. So they need to disinfect them, especially in this era of COVID, to ensure that the healthcare workers and even the patients are safe and protected from infectious diseases. Crowd control in dispensing areas and waiting areas is also part of the items we sensitize our members on. As you know that in most hospital pharmacies, the last point that the patient visits before they go home, and by then they are very tired and probably irritable, and they tend to crowd, and these can cause infection among the patient and even to the healthcare worker. So we reinforce social distancing even at the dispensing area to ensure that the pharmacist or any other healthcare worker is adequately protected. We also encourage our members to introduce medicine delivery services, especially for patients with chronic diseases, so that they don't have to come to the hospital. They are protected, and also the healthcare worker is protected from the contact. And we also promote medication therapy management for our patients so that we can be able to identify system or patient-related issues that are affecting the therapy of these patients and be able to address them. And for the oncology departments, we encourage rational use of the biosafety chambers during chemotherapy preparation so that our members are protected from the chemotherapeutic agent that can cause harm to their bodies. Next slide. So this slide just shows the scope of pharmacovigilance, and I might not dwell on it much today. I'll just mention medication errors. We encourage our members to report medication errors so that action can be taken. And this will work well in an environment where just culture is practiced. The person reporting the medication error who has committed the error is not punished, but the system is looked into to ensure that this is prevented from occurring again. So this will encourage members to keep reporting the medication errors to protect both the patient and even the healthcare worker, and also reporting on quality issues, as I've already mentioned in another slide. This protects the healthcare worker if it's an issue to do with the personal protective equipment. The healthcare worker using it should be sure that it's of good quality and it will protect them. Next slide. This slide shows the medication use process and where we come in as a pharmacist to be able to ensure that the patient is safe. We emphasize collective responsibility of all healthcare workers, starting from the prescriber, the communication of orders to the patient, whoever is dispensing, the healthcare worker giving the drug during administration, and even during monitoring. All these go ahead to ensure that the patient is safe as they use the medication. Next slide. So what are our plans to strengthen healthcare worker and patient safety as HOPAK? We will continue to organize CME sessions for our members to strengthen pharmacovigilance activities in hospitals. And we'll also plan to have a pharmacovigilance chapter in the association that will strengthen this objective, so that we are reporting on the safety use of medication in our hospitals. We also plan to address mental health issues of members by providing opportunities for debriefing and support for moral injury. As we realize that in our hospitals, especially in the public hospitals, we sometimes run out of stock of very essential drugs. And when a healthcare worker is not able to provide medication for the patient, or even any other service, they can be morally injured and they need support to encourage them that all is well, and there are ways that they can ensure that the patient is adequately treated. Also strengthening of the just culture in hospitals to encourage reporting of medication errors and enhance safety of patients, and also protect the healthcare workers. Next slide. And that's it. So thank you for listening.
Thank you so much for that.
Thank you so much, Dr. Clarice, for that presentation. Thank you for all the work that you're doing for the pharmacists that work in the hospitals. Indeed, they are on the front line every day. They're the heroes in health, in patient care. They do so much, they sacrifice so much, and they could possibly be exposed during their occupational activities, even to drugs, especially chemotherapy, for instance. They could have occupational exposure that could lead to adverse events. And thank you for what you're doing, for training them, for empowering hospital pharmacists to protect themselves and protect the patients, and to make sure in the end we have a safe health care worker and a safe patient. Kindly mute your mics. Thank you. So thank you so much. And for those who have just joined, welcome to the session. The panelists are presenting at the moment. They are sharing very great initiatives that they are undertaking in their different places and their different institutions. It's a great learning session. So thank you so much. You can still encourage others to join because the presentations are still on. And thank you, Clarice, for that presentation. So we'll move to our next panelist, who is Dr. Jaimini Gohil from Aga Khan Hospital. So welcome, Dr. Gohil, for your presentation. The floor is all yours.
Thank you, Dr. Winnie. Allow me to share my screen. Kindly confirm you can see the screen.
Yes, we can see the screen.
So, good afternoon, everyone, and I'm happy to present to you the health facility initiatives to provide safeguarding for health workers, welfare for patient safety. And I'm going to speak on behalf of the institution that I work in as a chief pharmacist, the Aga Khan University Hospital, Nairobi. And I would like to inform you all that patient safety is a teamwork. And with that, I would like to introduce the initiatives we have done as an institution. So the Aga Khan University Hospital is a JCI accredited hospital that's been in the country for 60 years. And it prides itself in making sure that we provide services that are of quality, that are of impact, that are relevant, and that are access. They are of all 4 pillars. And during this presentation, I will be able to give you the case in the Aga Khan, how we're actually providing healthcare worker safety in more context of the current pandemic of COVID-19, because that is the best litmus test of how we're going to make sure that a soldier is going to go for the war where the loved ones are actually saying, do you have to go? And you say yes. And as an institution, you have to provide a ground where the soldier goes back home winning. And I'm also going to talk to you about the pharmacovigilance that's happening in the institution, but the broader context of how we're letting it happen. And I'll have a conclusion. So I would like to start the presentation with, do you really know your healthcare workers? And the chain is as only strong as the weakest link. If you look through what I'm showing, healthcare workers is not what we see in the social media. It is not only the doctor, it's not only the nurse, it's not only the pharmacist. I want to tell you that without that housekeeper, without that caterer, without that clerk, without that administrative staff, you're not going to move forward. So when you're looking at health worker safety, you have to look at the front line and the people who make the front line shine to make sure that when the clinical care is enabled, they come out victorious. I'm yet to find an institution that's going to only say that they get everything done on their own. It's actually a teamwork. So my plea to all of you is when you actually look at health workers, we have to stop only looking at clinical staff. We have to make sure that the people who make it happen are also considered. So for the Aga Khan institution, we've actually probably looked at this kind of a flow chart. And it's like a flow. You have to have leadership. There has to be inbuilt culture. And then there has to be room for improvement at all times. What are we doing? How are we doing it? And do we have room for improvement? And are we taking feedback without any prejudice? Are we having no bias in the system that if somebody feels unsafe in that environment, somebody is able to speak up transparently and say, I'm not safe in this war and I can get wounded and I really want to tell you how to help me. So in the leadership, I have to tell you with pride that we came up with something called COVID-19 task force in the institution that was chaired by the CEO. That not only shows his commitment, it shows that he involved major stakeholders, the chief of staff, the nursing, the infectious disease consultants, and all the other allied healthcare to make sure there are resources. Because without the tools, the war can be lost. Not because you are not a soldier that had the information, the intelligence, the education, but you will probably not win the war. And also they made sure that there was foresight and forward thinking. In January 2020, Aga Khan was developing isolation beds for the patients who could be infected with COVID-19. And we were wondering that we've not even heard that in Kenya. It only came in March 2020. Why was the institution respected our senior leadership, knowing that they were preparing just in case we got an influx that we could have not been prepared for? The institution also provided vaccination for all Aga Khan staff for H1N1 vaccine in the first quarter, where literature suggested that there could have been protection if you take influenza vaccine. There is a lot of debate around that, but for the institution, any data that was coming that would protect the staff, the warriors were being protected. At any point of time in the COVID task force, whatever adequate PPEs are required for all cadres of staff was being discussed and ensured that it's available. We did not only look at international guidelines, we're working very closely with the Ministry of Health and our regulators to make sure that we are in line and we actually seek help and work in partnership with them. There were weekly COVID-19 staff forums where there was healthy dialogue and addressed any safety or any concerns that were common to all, just to make sure that we were together in this, and that if there was anything that was not known, that was not being addressed, is coming to the forum, and the CEO and the leadership that is there was answering them, so that it builds confidence that they're there for us. And there was a weekly newsletter from the CEO's office to make sure that awareness is at the top. The leadership also allowed working from home policy, ensuring that operations are not affected, so that if staff are not required to be in that environment where we were still learning what COVID-19 is, we're still learning what is going to happen to us. There were policies and procedures in place to make sure that the healthcare workers can take care of themselves and their loved ones. There was constant education through media with interviews with the hospital leadership, the infectious disease consultants as the experts, and doing capacity building to make sure that the information that we have is not only going to be at our level, it's spread across the country, and anyone who is seeking out to know how do we handle something that we had never heard of or prepared for. We also ended up supporting the county hospitals by providing observership by clinical staff, especially in the ICU care, knowing that most of the times, if we wanted to win the war, it was the critical care that was very important, and it is a very niche skill that we have in this country. What did we do for staff safety? We made sure as an institution that we have 6 months worth of PPEs inventory in place in the institution for all staff. And that was the leadership commitment. That was a heavy investment, but it was worth it. It was to make sure that if we have to go in the front line, we are prepared. All the staff were issued with hand sanitizers, 3 cloth masks, digital thermometer, as and when literature was supporting the use of cloth masks. There's a dedicated OSHA office which has been there from the time immemorial, but at that point of time, there was a staff given for only handling COVID-19 matters clinically and psychosocially. Everyone who has ever heard of COVID-19 was worrying about themselves, their loved ones, and many other financial and many other issues that were going on around that. So that office was paramount for us. There was an app that was developed called Staff Health Check. Every day, there's a daily reminder where there are basic questions being asked about your well-being, and that would direct you, should you be requiring a clinic visit, for you to go to the clinic, to be seen, to ensure that you don't fear if you have any symptoms, that the policy and procedures are going to enable a healthcare worker to say, I think I need help. If I have any cough or fever, I don't need to start asking corridor consultation. There was a beautiful system put in place that allows to vet objectively and give you peace of mind should you even have a cough, because at that point of time, if anyone coughed, people will run away miles away from you. There was continuous training and flyers by the infectious disease consultant, especially on donning, doffing, and other safety measures, because lack of information creates fear. And when there was continuous training, a person who probably feared, like myself, when COVID-19 came, I really was worried. But when these trainings were going on, we were more comfortable and understanding how will we deal with this? Should you get it? Should you not get it? And if you get it, how to handle it? We also developed physical barriers in all areas where we thought there could be exposure despite adequate PPEs. And that was to make sure that the healthcare worker is feeling safe, even if he had the N95 mask. But if he feels that point of time where he is not working and is not safe, the institution provided physical barriers and had an infection control team that went talking to a staff and find out, how do you feel? Are you feeling comfortable working in this environment? What are some of the things we can do to make you come out strongly, confidently, so that you make just decisions when you're doing your daily chores? The other thing that came up was the staff social support program, where there was unlimited access to hospital counselors that provided a safe environment and to be handled by trained professionals, because trust me, if you are not okay, you will not be able to provide the care that you would and should for your patient. Your well-being is of paramount importance, and that institution recognized and made sure there were avenues to handle that. Should you fall into a situation where you are infected with COVID-19, the institution made sure there was 100% coverage of an inpatient bill for yourself and the dependent to relieve you of the financial distress, and to make sure that you don't worry about the consequences, because you'd rather speak up, get treated, not worry about that, than keep quiet and infect the rest, even your family, and really not come out winning out of this. And there was an OSHA office that was making sure you were provided with a pulse oximeter, a thermometer, and an app where you daily download your data, so that we are monitoring you remotely and make sure if you need to come to the hospital for a clinic or admission, you are being taken care of, so that everybody is not in the hospital at that time. what did we do for the patients? Because at the end of the day, if the patient is also not taken care of, the care worker is also not safe. So initially, we developed a COVID-19 hotline because we started to notice anybody who coughed or sneezed ended up coming to the hospital, and that was creating panic. The hotline was a vetting process to make sure that large crowds were not in the hospital. We also quickly followed suit with international policies, guidelines, and what our regulations to make sure that the patients who need care, who fear coming to the hospital because of lack of knowledge or because they have apprehension, they had teleconsultation, which allowed them to see a very trained physician, get the diagnosis, get the treatment with home delivery. Should you require phlebotomy services, we even had home phlebotomy services to make sure that when we say we care for you even when there's a war. Even when you think that it's very difficult to come to access to the hospital, which was never the case, but we had to make sure you're taken care of in whatever situation you are. We also developed temperature checks in all points of entry in the health facility so that you realize we have a screening and a vetting process so that you know that if there is a patient who is suspected, they will be taken in another environment and you're safe in the hospital. The COVID testing booths were also designed in such a way there was maximum protection for both the healthcare worker and the patient and away from the clinical areas to prevent any fears and to also give those staff who are working there the peace of mind that they're taking care of these patients and they're able to do it comfortably. Patient education posters and all information through our media was provided so that an educated patient will do the right thing and therefore protect our healthcare worker. Any inpatient was provided with free COVID-19 testing to make sure that the staff who is dealing with these patients is confident and comfortable where the status is out or the result is out to know how do I deal with it, because we were trained to deal with any. Having infection does not mean we're not going to deal with you. We'll just have the appropriate PPEs to make sure that you and the staff working with you is protected so that we take care of you and we don't injure the army that's taking care of you. We also made sure that we had a field hospital way before even we had a peak or we had an influx, but we want to prepare to make sure should we get something that is going to overwhelm the hospital, we have something that is going to take care of the capacity. We made sure there increased hand sanitizer, frequent cleaning of all the surfaces where the patients would be moving around, the healthcare workers, to make sure there's a safe environment for the patient. We did a drill to make sure that a surge drill to make sure that should we get an influx, how will we handle it? It's one to have theory and one to practice and say, when things actually don't look normal, how will we handle it? And to make sure we do it with quality in an extreme environment. Let's go to pharmacovigilance. In pharmacovigilance, I'll tell you a broader context. What is inbred in the hospital, because we are a JCI hospital, we already monitor medication error, near misses, and report them to the adverse drug reactions to our regulator, Pharmacy and Poisons Board. It's inbred in our quality variance indicator. That means our Pharmacy and Therapeutics Committee question us when there are medication error, near misses, ADR, and we make sure we feedback and resolve. Where there is a hotline that's manned by pharmacy where all state healthcare workers can report without having to worry about what's going to happen with that information. And pharmacy takes the lead to make sure that that information is given closure. The clinical pharmacist task force made sure that all COVID-19 patients, they were working around them and making sure should there be use of any simple medications that we know about or any off-label medications or novel medications. There was medication reconciliation and pharmacy interventions. The aim was to make sure that when we are treading in unprecedented waters, when we really don't know what does this medication that's off-label can do to a patient, we had a team of experts watching over keenly, advising physicians and making sure that the healthcare worker and the patient are both taken care of. The nurse should feel comfortable. My clin pharm is going to look after me. The doctor knows the clin pharm is looking after it. And the patient knows, somebody is going to report if I'm not going to be okay. So that was a very important make. For example, with remdesivir, when it came, it was very tightly controlled with our regulator, which is absolutely what is required. And we made sure that we were careful. That was only approved by infectious disease consultants because we're not the experts. We wanted to make sure the experts vet the patient. We look out of the pharmacovigilance and report should anything be amiss. We also have speaker posters in the hospital, which is over and above the pandemic, which is what allows the hospital staff, the healthcare workers, anyone to feel comfortable, including patients, when they feel this environment is not safe, intimidating, if there is something that they think that needs to be addressed. And the COVID task force made sure that should there be any issues regarding medications, PPEs, anything that would make them unsafe in the environment, including stigma, including if there is a staff who feels that they're not feeling comfortable going in a clinical area because they are probably feeling vulnerable and they want to be talked to or somebody to explain to them or reallocating of responsibilities. That was done through the COVID-19 task force. The institution also made sure that we were working very closely with the regulator, the Pharmacy and Poisons Board, Pharmacovigilance Department, ensured our ADRs are reported. We also had a discussion on how the safe use of off-label medications are being done in the Aga Khan with the COVID-19 treatment. And we were able to work around to see what are some of the processes we have that help us to identify them and how can we improve further, making sure that we provide safe care without causing harm, even when we don't know much about that medication. And even with PSK, we have a dedicated clinical pharmacist, Dr. Ruben, who makes sure that he gives the constant updates from the institution, also all in his capacity as a pharmacist, and make sure that awareness that whatever information we have, whatever gains we have, is shared with our profession and nationally and internationally. In conclusion, I would like to tell you that all healthcare workers, regardless of their cadre, are critical for patient safety. As long as they're healthy, happy, and safe, they are your key to patient safety. A leadership without commitment is not possible. You will not be able to achieve half of the things that have been said because the leadership plays the most important role and foresight. Without a team, your chain is as strong as the weakest link. So each one of you needs to know that you're important. If a housekeeper is not feeling safe, then definitely even the senior leadership is not going to be in a safe environment, because that is a clean hospital is important. If the caterer is not feeling safe, then there is going to be a problem because the patient will not get a very tasty meal. So I just want to end with that. And with this, I would like to say, healthcare workers, our future is in your hands. And this is what we did as an institution to make sure that we are safe. Thank you.
Wow. Thank you so much, Dr. Gohil, for that comprehensive and clear presentation. I really love how you've taken us through the journey that Aga Khan went through during the COVID preparedness and during the pandemic period. Indeed, we were all scared. As healthcare workers, we were scared. We were scared for our families. We were scared for ourselves. We were scared for our loved ones. We were even scared to go to the hospitals. But you took it up, you took the challenge up, you got prepared in such a short time, you put in place so many measures to just make sure that the healthcare workers are safe and the patients are also safe. It was such a huge investment. Your leadership was so committed in taking lead on this, and I think the only thing I can say is that it's a great initiative, and that's just wow. We can all learn from what Aga Khan did. We can all learn from what all the other organizations are doing. And thank you so much for taking that sacrifice to make sure that our frontline soldiers are safe. So thank you for that presentation. And at this moment, I will then invite Dr. Gitau to talk to us. Dr. Elizabeth Gitau, sorry for the hitches that we had at the beginning. I hope your connection is now good.
Yeah, I'm good now. Thank you very much, Clarice and team from CAPI. If you can all hear me, good afternoon, and thank you very much for this privilege to be able to present during this webinar. To introduce Kenya Medical Association, this is a national association of medical doctors, which brings together over 3,000 medical doctors across the country. And our major mission is to champion for the welfare of doctors and to champion for quality health. And that is why this year's call by WHO regarding patient safety and health worker safety as an ingredient to patient safety comes in within our mission, which is to actually champion for quality health, which includes patient safety. So I have heard from different panelists who have shared experiences from the various associations based on what they are doing. And even I have heard from NNAK what we have been able to do together. I will be repeating some of the things that we have done together, maybe to give a little bit of more context from my side. And again, also for the kind that was brilliant preparation. And of course, again, also to reiterate is that I think in our country, if this was taken to a national level, I think the COVID-19 response will be at a much better place if we had adopted what was mentioned from Aga Khan. So to mention what Kenya Medical Association has done regarding health worker safety as an ingredient for patient safety is that during, with a more focus on COVID-19, there are various initiatives that we have had before COVID-19 regarding health worker education to bring up their capacity to be able to take care of patients better, and in terms of dissemination of various guidelines by the Ministry of Health to our members who take care of patients. So those are some of the activities, including our physician wellness program, which was aimed at supporting the healthcare workers as they go about their roles through peer support and through linkages to psychological care. So the COVID-19 pandemic, when it landed here in Kenya, there are various initiatives which the KMA took up in order to take care of our healthcare workers, and again, as a result, ensure patient safety. And key among them is the formation of the Kenya Medical Association COVID Response Advisory Committee. And this committee was formed with an initiative or with an aim to ensure that we get recommendations from our members and recommendations from medical experts, which we were able to advise the government, our members, and advise the public regarding the COVID-19 pandemic. And some of the resolutions that have come through the Kenya Medical Association is regarding one, provision of PPEs. We have continually lobbied for the provision of protective equipment for the healthcare worker, which protects the healthcare worker and in essence, protects the patient and keeps the health system running. And through this initiative, we have been able to work with the Kenya COVID Fund and the Equity Group Foundation towards provision of PPE worth about 1.2 billion to healthcare workers across the country. And we have worked with the team to ensure that the quality of this protective equipment is up to standards, to ensure that our healthcare workers do not have substandard PPE and they are fully protected. The other resolution that has come through the Kenya Medical Association COVID-19 response is regarding compensation of healthcare workers, that we have called on the government to ensure that healthcare workers are compensated for times that in which they get into contact with COVID-19 infection. Another thing that directly relates to patient safety that we have called for, especially in the public sector, is employment of adequate number of healthcare workers. Healthcare workers who are taking care of patients which are above the numbers that they're supposed to take care of are easy to make errors. They work long hours, they are fatigued, and as such, patient errors may occur and have a direct impact on the patient safety levels in our health system. So we continually have called for increased numbers of healthcare workers in our health system, which has a huge shortage. The other thing I would say from the KMA crack in terms of health worker protection is in terms of COVID-19 testing in the hospital. We provided guidance or recommendations to the Ministry of Health, again, to ensure that our healthcare workers are given priority in terms of testing. And patients who come to hospitals for various other illnesses, measures are taken to ensure that the healthcare worker do not get infected while taking care of these patients, and also encouraging COVID-19 testing within the hospitals, even as patients get their care. Another response that came from the Kenya Medical Association, as has been mentioned before by Jemimah, is in partnership with other healthcare associations, as has been mentioned. We have taken an initiative, 1, to train the healthcare workers, number 2, to provide psychosocial support for our healthcare workers, and number 3, to provide PPE. Through this partnership with NNAK, KCOA, KMPDU, Critical Society of Kenya, and other associations, we have provided training within the COVID-19 isolation centers across the country, that is the public health facilities. We have provided COVID-19 case management, which also comes with psychological first aid training for our healthcare workers. We have gone ahead and provided online webinars every Thursday to empower and improve capacity of our healthcare workers. And part of this training includes PPE donning and doffing for their protection. We have been able to provide psychosocial support through help from NNAK and provided mental health webinars with our other partners, as Jemimah has mentioned. Those are especially some of the partnerships that we have been engaged in as an association. Again, to mention is that KMA, during the at the time when MOH was doing the first trainer of trainers training, we were able to record these sessions, and this has been availed to over 1,000 healthcare workers who have had access to the full training online for those who are not able to participate offline. Those are some, I would say those are the initiatives that we've been able to engage ourselves with. And this comes also in terms of dissemination of the various COVID-19 guidelines to our various members. We have been able to meet the Senate in terms of lobbying for patient safety. We have been able to meet the CECs of health, and again, lobbied for the same health worker safety. We've lobbied for COVID-19 testing. To emphasize is in terms of patient safety and in terms of healthcare workers as a basis for patient safety is that the culture in medicine, especially in terms of correctly defining the working hours of a healthcare worker to ensure that we are safe for our patients to be safe, needs to be looked into. Even as we grapple with shortages in human resource for health, we continually call for adequate allocation of timing, especially to the nursing workforce, to ensure that people are not working over hours, people are not working 36 hours, which actually impacts patient care and impacts patient safety. Thank you very much for the invitation. I will hand over to the moderator.
Thank you so much, Dr. Gitau, for that presentation. Thank you so much, Dr. Elizabeth Gitau, for that presentation and for telling us what KMA has done, the initiatives that you've taken to protect doctors, the collaborations that you've had with other associations like the Nurses Association, the lobbying that you have done in the background, and just advocating for the doctors' safety and other healthcare workers' safety. Thank you to all the panelists for those presentations. We have learned a lot. And before we move to the Q&A session, I'd like to just reiterate on what the presenters have presented today, all the panelists, that there's already so much that is being done, and we are really grateful for all the work that you put in to just make sure our healthcare professionals are safe. And it's very important that this year the Patient Safety Day is actually focusing on the healthcare workers' safety, because the healthcare workers are a very important pillar in the healthcare system. They are very important. They're the unsung heroes. They are the heroes. They sacrifice. They do so much for us, and the healthcare system cannot run without the healthcare workers. So thank you so much for those presentations, for the brilliant initiatives, for putting in so much work. And now I'll open the floor for questions. Keep sending your questions on the chat. I'll read the questions that you already have on the chat and also ask the questions that I have to the panelists. So from the chat, we have a question from Baraka, and it's directed to Jemimah. So the question is, if I heard you well, Jemimah, the Wellness or Support Center has received very few calls. I think you mentioned 50 from your presentation. So 50, more than 50, you have received 50 calls, more than 50 calls from the nurses. I think the expectation was because of the fear, because of COVID, because of what was going on, then we expected that maybe more healthcare workers, more nurses would have come forward to seek for support. So is this an indication that the healthcare workers are fine, or are they shying away from seeking help?
Thank you very much, Dr. Winnie, and that's a very, very good question. One thing we probably, for everyone else on the call, will agree with me is that for a long time, healthcare workers have been, and I like to call them healthcare professionals, but for the sake of what the previous presenter talked about, that it's beyond the professionals, and we also include the other support staff within the institution, is that especially the core healthcare service providers, traditionally they're known to be the ones to provide solutions. So again, as I said, this being a pioneer program within our region, I think from our own survey, actually the kind of numbers we're getting, they're more positive than what you would probably expect, because sometimes we expected to be the ones who are providing the service and not necessarily seeking it. And people actually making that very bold step to say that it is actually okay to seek help from another healthcare service provider. And in this case, it's not physical, it's in a way to support you psychologically and mentally. So it is also a way we are trying to tap on the soft aspect of who we are, not only as healthcare professionals, but also as human beings. So for us, we're actually seeing it as a very encouraging step, and we are expecting that the numbers going forward will actually increase, because we will have, we've developed a model of delivery whereby we also have a system where we will also be scheduling calls for people who want to do group therapy sessions. We will have county Zoom debrief sessions, so the call center will be able to support not only the call-in numbers, but will also now be reaching out to healthcare professionals themselves. So, Dr. Winnie, that's a very valid concern, but I think from us is that we want, what you're telling healthcare professionals is that it is okay to come out and say that, you know what, it is time to have that soft conversation that seeking help is not a sign of weakness, it is actually a sign of strength, and that we too need saving sometimes. Thank you.
Thank you, Jemimah. So in addition to that question, I will ask another question just that is linked to this question that Jemimah has just answered. And this question is directed to Dr. Gitau, Dr. Daniella, Dr. Clarice, and Jemimah again. So the question is, as leaders of different professional associations, you have presented on different initiatives you are driving to safeguard the welfare of your members. What are some of the challenges excuse me. What are some of the challenges and hurdles that you are facing in the space, and how can they be addressed? So Dr. Daniella, you can go first.
Okay, thank you. Thank you. I think that's an excellent question, and it's relevant to all the health professionals. So one of the significant challenges, especially in this era of COVID-19, is that for some reason the disease is not reimbursable in the usual fashion by the insurance companies, and so in terms of equipping the health professionals with what they need to protect themselves, we have had requests from our membership to lobby for them to even be allocated PPE in their areas of work because they feel it's inadequate. And government has all these supplies that they provide for free to the public health facilities. So we've noticed sort of like an underfunding, especially in the private sector, for PPE and other requirements for infection prevention and control, thereby putting our health professionals working in private sector, some of the private sector, at risk. And so that we have noticed an uniform response in terms of protecting health workers across when you compare the public and private sector. So that's an advocacy issue. It's a huge I think the other challenge we have faced is basically our health professionals in different levels of the health system have had varying levels of preparation. So you find the ones in the much higher facilities are very well equipped with knowledge from their own institutions. They're handling, they have the COVID isolation wards, and they have the wherewithal, for infection prevention and control. While those in the lower facilities possibly are considered lower risk of contracting the infectious disease, but they're still exposed. And so these are just systemic challenges that we've observed that have been difficult for us to prepare all our health professionals equally in the COVID-19 pandemic. Thank you.
Thank you, Dr. Daniella, for that comprehensive explanation. I'll throw the same question to Dr. Clarice. What are some of the hurdles that you have faced?
Okay, thank you, Dr. Winnie, for the question. Yeah, as an organization or a professional association, as we try to safeguard the welfare of our members, we face several challenges. The biggest one being lack of adequate personal protective equipment, especially the masks. And in this case, not just for protection against COVID, but even for protection during preparation of chemotherapy. Pharmacy staff need N95 masks in order to protect themselves from the drugs that they're preparing for the patients, and these are not always available. On top of that, they don't have adequate biosafety chambers. These equipment are not cheap, and for facilities to have adequate chambers, it's not easy. So some of the pharmacists end up preparing these drugs without using the biosafety chambers, which is such a health hazard. The other hurdle is that sometimes we are not in control over which PPEs we are going to receive, especially in terms of the quality. You could be supplied with a poor quality brand, and you can't do anything about it. You are obliged to receive them and distribute them to the healthcare workers. So this becomes a challenge because some of our inspection and acceptance committee that are supposed to inspect goods before they are received by the hospital are not functional, and we end up receiving goods of poor quality that are not protecting our members adequately, either from infections or from chemotherapy agents. We also have an issue with stockouts. I had already mentioned this, and this is causing a lot of moral injury to our members because if you're not, a patient comes with a prescription and you're not able to fill it, then you really get disappointed also, and you feel like you've not done your best, but it's actually beyond your control, but you end up getting moral injury because you are disappointed with the state of affairs in your facility. Yeah, those are my comments, and back to you, moderator. I'm through with my comments.
Thank you, Dr.
Winnie?
Clarice. Yes, I can hear you. Thank you, Dr. Clarice, for that response. You have brought in another aspect on the PPEs. So other than availability, we have issues to do with the quality. And this question has also been asked on the chat. So I'll read what is on the chat and also bring in the other perspective, because this was my next question to the panel. So the question is, now especially for masks, they're being made and sold everywhere. So how safe are healthcare workers, considering that patients who visit health facilities may be using substandard PPEs? So what are the panelists doing in the different capacities to strengthen this weak link? And to add to the other aspect of that question, sorry. So the other aspect of that question is healthcare workers have been put on extra distress, both in terms of risk of infection to COVID-19 and concerns over PPEs, quality and availability. At the same time, psychological strain is overwhelming. How have you, as associations, plugged in at this point to support your membership? So I'll direct this question to Dr. Gitau and Jemimah. So Dr. Clarice has mentioned that sometimes they receive poor quality PPEs and they're obliged to receive them and distribute them. So as associations that are supposed to advocate for the rights and safety of your members, what are you doing in your capacity? So Dr. Gitau, you can go first.
Thank you very much. Yeah, thank you very much for the question. From our perspective as a Kenya Medical Association is that from the beginning of the pandemic through the KMA COVID Response Advisory Committee, we cautioned our members, number one, regarding the presence of substandard PPE in the market, and we gave them advisories that they should not accept substandard PPEs from the various from the distributors, and even gave them we gave the health managers ways in which they're able to assess the PPEs. The other work that we've been able to do with the Kenya COVID Fund and Equity Group Foundation is that we have gone through the trouble of checking the quality of the very PPEs that they're procuring for distribution across the country. We have gone to the local manufacturers to aid them in terms of ensuring that they're manufacturing the quality PPE and how to check for quality PPE. We have formed hospital liaison teams in the various COVID-19 isolation facilities who, number one, help us in terms of giving feedback regarding the quality of the PPE that they have on ground so that you can have a continuous improvement regarding the quality of the PPE. So again, it's a big challenge, of course, for managers, especially in the public sector, where you have PPEs which are procured through either the KEMSA or through other county procurement channels, which don't meet the standards. But a good practice would be to have the various managers have a standard of checking for the quality PPE and have a way in which they're able to get feedback from the end users, that is the healthcare workers, on the quality of the PPE, which will aid in terms of future procurement processes.
Thank you, Dr. Gitau. And Jemimah, on your part as the Nurses Union, the Nurses Associations.
Thank you very much, Winnie. Let me give an example of what we have done in terms of advocating for quality PPEs. We had an incident in Kisumu a few weeks ago, and whereby the branch chairperson for NNAK was very vigilant in terms of writing to KEBS and requesting for recall of some of the PPEs that had been distributed, and KEBS was able to do standard check for these PPEs, and they were found to be substandard, and they were actually recalled from the facility. So at that level, what we keep advocating for is that we had rather no PPE than substandard PPE, because that puts the healthcare professional at an even greater risk than wearing it just so that one is seen to have worn a PPE. So at that, from that level as the association, we've been able to be very keen to remind our members to be vigilant in terms of their quality control checks for PPE. We've also been providing videography to just help in terms of looking at the quality of the PPE, what to look for, especially when you're receiving PPE, and what to ensure, what if you need to write a report, just to make sure that you've gotten the right kind of equipment. And this not only happened in Kisumu, it also happened in another county, where again, one of the NNAK branch leadership member was able to write back to the institution and say that the PPE they had received at that particular moment was not the quality that is required. So that's what we've managed to do at that level for our members. Thank you very much.
Thank you, Jemimah. So thank you for that clarification. I'll direct the next question to Dr. Jaimini. So as a health worker in one of the premier hospitals in the country, and that is Aga Khan University Hospital, what are some of the concerns to health workers' safety, and how are you driving them at the facility level? Do you have an engagement with some of the professional associations to share best practices that can inform the advocacy agendas for members' welfare? So as from your presentation, you did a brilliant job as Aga Khan University Hospital in the preparation, in the implementation. You had full leadership support, but is there a way you're engaging with the professional associations to share best practices so that they can inform in their advocacy, to just make sure all the other healthcare workers are happy? As you said, the Aga Khan healthcare workers are happy and safe.
So thank you for the question. What I can say, as you rightly said in the presentation, I said how as an institution, we've been able to provide a forum for staff psychological support, staff weekly forums, and we have been engaging any of the medias when we have interviews to say what we're doing and how we're doing things, but we've not actually had any association with any organization, at least best to my knowledge, and I can get back to you on that, is that we have not been able to actually become like a healthcare provider that can give the advices of how to handle any of the issues about healthcare workers in terms of their psychological support. But what we have done is, wherever there was a national meeting and all the leaders of the healthcare organization, including our CEO, when there was MREF CEO, they were all called upon to say, what are you doing in your institution for your healthcare workers, and how can we learn from it? In that forum, yes, Aga Khan did share what I've just shared with you, to make sure, have an environment where people can feel safe to go and talk about it. For example, there was a hotline where you can call. You can have your visit to the counselor without anyone getting to know what was happening, and you were taken care of. But having a professional association that we're working with, I'm afraid I may not be able to answer that right now. I'm not aware of any.
Thank you. Thank you so much, Dr. Jaimini, for that response. Thank you for clarifying. And we wish that whenever you have that opportunity, like you have explained, you can share the best practices so that then other institutions, government agencies can adopt that, so that then we make sure everyone is safe and we can learn. And of course, we have to learn from each other and adopt best practices. So thank you so much for sharing that experience and for that response. And now my final question to the panel. So before I read my final question, there's a question from the chat from Hussein Kuzema. So the question is, how does one check the quality of PPE? I'll direct this question to Dr. Gitau. Like, if you can just give a brief explanation on what people need to check, how they can check it to ensure that it's a quality PPE before they can don. Hi, Dr. Gitau. Hi, Dr. Gitau, you're on mute. Okay, so it seems Dr. Gitau cannot hear us, or maybe her connection has a problem. So let me redirect this question to, let me direct it to Dr. Jaimini so she can tell us how they have been doing it at Aga Khan. How do you check for the quality of the PPE?
Thank you for the question. So any PPE that comes to the institution goes through a vetting process, and it's a multi-stakeholder team that takes care of it. So we have the purchasing department, we have the infection disease control department, and we have the pharmacy involved when it comes to, for example, if anything that comes from the board, the approval, the registration. We look at at least the prerequisite of KEBS, the registration, and we make sure that even when it comes, the team actually looks at the specs. We use the international guidelines and even our national guidelines to find out for what function and what task force would require. Look at what we have got in hand, knowing that there was a significant shortfall for shortage in the market for the best of the qualities, because whatever was the best was running out, and we had to make sure that even the second best, how do we make sure that it is good? So the team would look at it, look at all the specs, make sure that their legal requirements are met as a priority. And the team would also make sure that once it goes into the circulation, there is an infection prevention control team would walk around and find out from the users on how that is working. If it's fit testing for the N95 mask, for example, if it's a surgical mask, if anyone complained that they were getting any rashes or that it was breaking, the straps are breaking, or when you do the tie-ons, they are opening up, or there is anything that is of concern, was immediately being feedback back to the team that was working on it, and also back to the COVID-19 task force where the leadership is involved, so that if there is a decision to keep, withdraw, or look for. And what we made sure that at any point of time, we were making sure that the guidelines were helping us. What are some of the best practice guidelines that were there? And also we were trying as much as possible to support our local production as well. As long as our local producers were able to tell us that they have met the minimum requirements, we would feedback with them. If they improve further, if in case there's some issues that they had to resolve, we made sure that we were not only looking at international PPEs, we were making sure that whatever is even locally available, support our people and make sure that regular constant supply is there. That's how we did it. And we had significant challenges in making sure, how do we identify a counterfeit? How do we make sure? And we were thoroughly engaging Even our regulators, should we find out something, we were informing them. Should KEBS inform us something, we were working on that. So that's the system that we deployed in identifying the quality.
Thank you so much, Dr. Jaimini. There's another question on the chat, and I'll read it. So how can we drive this agenda of patient safety and healthcare worker safety, especially in the private sector, considering earlier contributions on shortfalls in some, while institutions like Aga Khan University Hospital are getting a way around it? I'd like to direct this question to Dr. Daniella. So for the health workers in the private sector.
Yeah, thank you. So I think then this is where institutional associations come in, because as professional societies, we represent our health professionals, individual health professionals. But when it's a sector-wide problem like that, then we need to come together as societies and form an umbrella of another association, and those exist. And for example, I know all the associations present here today, we are members of Kenya Healthcare Federation. So at that level, advocacy at that level is on sector-wide changes. And I know KHF has engaged in advocacy. Actually, they actually got, from KHF got permission for the private health facilities to purchase PPE directly from KEMSA, which was a very groundbreaking policy shift just for the COVID-19 period, because the KEMSA Act is very clear that KEMSA only supplies public sector. But because of the issues that were being faced by private sector, at the KHF level, we actually advocated for and were successful in getting permission to, KEMSA was given permission to sell to us. Of course, we all know then the challenges that happened with the procurement of PPE for the country by KEMSA, and those PPE ended up being way more expensive than what was available through other channels in the private sector. But forget the problems that happened at KEMSA. That policy shift in itself was a very big win and would have worked wonderfully for private sector to access PPE at very subsidized, at very low prices. So I think the short of it is those sector-wide issues then call for us to come together as the different associations under a bigger umbrella to do advocacy at that level. Over.
Thank you, Dr. Daniella. And thank you for that approach that you have brought up, that we need to come together, we need to have a united front to solve some of these issues, because at the end of the day, they affect all of us. And so the other question that I have now, this is to all the panelists. I'll read this question. So to ensure health worker safety, there is need for collaboration among different players in the sector. So what will be your ask to the pharmaceutical industry to join you in your efforts? So as Kapi representing the pharmaceutical industries, we would like to hear from all of you on how we can contribute to this. So I'll go around, I'll take a round on this. Let me start with Jemimah.
Thank you very much, Dr. Winnie. I think my ask to Kapi would be to strengthen programs like the antimicrobial stewardship program that should be rolled out in some of our healthcare facilities. And especially, and to add on to what Daniella has said, not only to the government healthcare facilities, but also strengthening the private sector. And private sector here, considering the lower level private sector individuals who probably run their own clinics and facilities. This is one group of people professionals who are sometimes forgotten when priorities are probably being lined up. So being able to really support their capacity in terms of their pharmacovigilance and antimicrobial stewardship, getting them updated on what is the current practices, what is in the market and what is no longer considered to be current protocols is one of the areas I would really ask CAPI to focus on, and even as you build capacity for still the mainstream healthcare facilities. Thank you very much.
Thank you, Jemimah. Dr. Gitau.
For us, from a medical association perspective, the pharma industry, the kind of assistance we'd want, or the more lobbying that we'd want, is one is in terms of quality of medical products that we have here in the country, especially pharmaceuticals, to ensure that the industry ensures quality and ensures safety of medication that are available in the market to avoid counterfeits or expired drugs being accessed by our patients. Thank you.
Thank you, Dr. Gitau. Next, Dr. Daniella, what's your take on this?
CAPI can certainly support the associations a lot. And I think one of the high impact ways is to support our CPD programs and just, support us in workshops, conferences, and CMEs to disseminate guidelines, policy documents, key opinion leaders, expertise with our members. So if CAPI can rally your membership to support the associations to roll out CME, I think this, and you have been, so this is, I'm just saying that this should continue or even increase so that we capacity build our professionals. Thank you so much for the opportunity to speak this afternoon.
Thank you, Dr. Daniella. And the representatives of the pharmaceutical industry, some of them are in this meeting, so we are all listening. So next, Dr. Jaimini, how can the industry support you?
Thank you for asking this question. I think the industry can support institutions like the hospitals, private, public, by providing an avenue where when you find out information about quality concerns, about issues about pharmacovigilance, how we are communicating it, there is probably very little room for two-way traffic because it's very isolated. Probably an institution writes and the information is provided back to them. Maybe a good forum where professional associations that we already have, yourselves and the hospitals can have a mutual platform of communicating matters of issues, suspicion. By the time you're reporting an ADR to Pharmacy and Poisons Board, it's a legal requirement, and you probably have some people who would not do that because there is fear of what that information is going to do. But if you have a forum, you have a platform where there is information share, and that there are stakeholders of mutual interest who can address that Q&A, I think that is very important, because today this is a webinar. You've learned from me, I've learned from you, and there's so much we've learned, and probably we should have a continuous curve of learning. Can you enable that? And I would like it if you could do through PSK by, for example, supporting their CPD. There could be some continuous communication between us, because I see there's a huge potential in each one of us. There's so many brains out there. If all of us could put something into a common pool, we will probably solve such issues that we can't do it individually. Thank you.
Thank you. Thank you so much, Doc. And finally, Dr. Clarice, how can the industry support HOPAK and your initiatives in ensuring that the healthcare worker is safe?
Okay, thank you, Dr. Winnie. So my request to the industries would be that they should support conduction of post-market surveillance for their products, of course, through the Pharmacy and Poisons Board, so that they are able to identify safety and quality issues that are affecting their products, and even be able to detect if there are counterfeits to their products in the market. Also to encourage users to report therapeutic ineffectiveness of their product so that they can go back to the laboratory and even check if the active ingredient is adequate in their products already in the market. The other thing I would request them is when their products are recalled from the hospitals or from the market, they should fast track collecting them from the hospitals so that we don't end up using them again, because sometimes they stay there, they are not expired, and whoever was not privy to the information that this product was recalled could end up using it and cause harm to the patient or to whoever is using it. So those are my comments, and thank you for giving me an opportunity to speak.
Thank you so much, Dr. Clarice. So I have seen a comment from Jemimah on the chat that just an addition, we could also support and encourage professional associations involvement in clinical trials and building our local capacity to publish high-level research for the development of science and technology in Kenya. I totally agree with this. I totally agree with these remarks, Jemimah. We need to encourage and build that culture where we do our own research, we collect our own data, we make decisions for our own patients and healthcare professionals and the healthcare sectors for our country. So thank you so much. Let me give my final remarks. So thank you for participating. And a big thank you to all the panelists for creating time to share with us the great initiatives that you're doing. Personally, I have learned so much from this. As the pharma industry, from where I sit as a patient safety responsible, mostly we look at the drug and what it does to the patient. But from our capacity now, I think our eyes are opened now. There's so much we can do to support the healthcare workers, healthcare professionals, safety, to just ensure that, because as long as the healthcare professionals are happy and safe, then we are assured that even the patients will be safe. So thank you so much for participating. Thank you so much for presenting. We are really grateful. And I'll hand over this session to David to close it out. Thank you so much.
Thank you so much, Winnie, for the wonderful moderation and for the great insight that we've had from our panelists as well. It's been a pleasure learning from you. It's been a pleasure getting to know the challenges that are in the industry, the initiatives that you guys are driving, because at the end of the day, the aim is to ensure the patients get the best quality care they can, and that care is delivered by the healthcare workers who are represented by the associations. So if the associations can get the initiatives that are being driven to support healthcare workers, that translates to quality healthcare. So as an industry association, the commitment is how do we chip in? And it's very enlightening that most of the members are looking at how do we drive capacity building initiatives for the healthcare workers? How do we support research? How do we support knowledge sharing? And at the end of the day, that research, knowledge, and clinical practice informs the policy. That is now the policy advocacy agenda. So moving forward, it's a matter of learning from this, looking at ways we can improve quality care in the country. And now engagement continues from this discussion that we're having. It's been a pleasure being with you. We've learned, and moving on from here, we'll keep reaching out to most of the members of the different professional associations and the professional societies and our member companies so that we drive a common agenda for improved access to quality healthcare services anchored on safe, quality, and effective medical products, healthcare technologies. Thank you so much.
Thank you very much and have a lovely evening. Bye-bye.
Bye.
Thank you. Bye.
Thank you. Bye.